Good morning, everyone, and welcome to the third webinar in our series of 4 that we are delighted to be hosting with Welby Assist. This morning we welcome Sally Ann Hurn, who is an Assurance Director here at Duncan Toplis. She's also the Sustainability Lead and has been heavily involved in looking at our own environmental, social and governance matters. Last week we published our Impact Report, and this collates all the great work that we as a firm have undertaken in the last 12 to 18 months. We are aware that ESG matters impact our clients in different ways, and the NHS is leading the way in creating strategies to reduce their impact on the planet. The strategies that they implement will encourage other sectors to take the plunge into ESG matters to ensure that we create a more sustainable future for generations to come. We will then welcome Chris Jarvis from Welby Assist, who will be covering the third WE statement, effective. If anyone has any questions, please do pop them in the Q&A chat and we will answer these at the end of each session. There'll also be a feedback form coming out, so do please put any questions on there if you haven't in the Q&A screen. So Sally, welcome, and I'll pass over to you.
Good morning, everybody, and thanks for your time for listening to our webinar. As you can hear, I have the cough that everybody else seems to have. So yeah, if you think my voice is going, don't worry, I'm sure it'll hold out. Okay, so as Kay said, we're just going to have a little chat about ESG. So first of all, what is ESG? So the purpose of my explanation today is to explain what ESG is, how it impacts the NHS, and also give you an idea of how it impacts us as an accountant. I expect to be talking for about 10 to 15 minutes, and then Kay will be chairing questions and answers at the end. So if you have any burning questions, please add them to the chat and I'll be happy to answer them at the end. We hope by the end of the presentation, you'll have a better understanding of why ESG is so important to both the NHS and also Duncan Toplis and future generations to come. So what is E, S and G? Sustainability strategies can vary significantly from business to business, but everyone aims to create a sustainable future for generations to come. And this can be through the 3 core themes, so environmental, social and governance. Environmental includes the reduction of carbon footprints and wasteful practices. Social is practices that benefit our members, clients, patients and the wider communities. And governance is maintaining honest and transparent practices and regulatory compliance. So who's impacted? Everybody. Everybody this will impact over the next 10 years. You may be caught within scope 3, so your emissions, you may have a supplier who says that you have to calculate your carbon emissions, or even parent entities. EU rules are stronger than ours, so it could be that clients and some of your patients are caught by EU companies. Also fundings. Banks are not looking to issue loans to certain companies unless they have ESG rules in place. Also, it impacts recruitment. So to attract the right talent, you'll notice that lots of people are more interested in ESG matters. So just a quick overview of the different kind of scopes that impact environmental. So scope 1 covers emissions from sources that we own and or control directly. So this will be fuel used in our boilers and pool cars or owned vehicles. Scope 2 emissions are those that we cause indirectly when the energy we purchase and use is produced. So this, for example, is heating and cooling buildings and the energy that's being produced on our behalf. Scope 3 is usually the largest and covers all emissions that we're indirectly responsible for up and down the value chain. So this includes buying products from our suppliers. So making it relevant to the NHS and net zero. In October 2020, the NHS became the world's first health service to commit to reaching carbon net zero in response to the profound and growing threats to health posed by climate change. The Delivering a Net Zero Health Service report sets out the clear ambitions and 2 evidence-based targets. Thanks to NHS people, partners and suppliers, the NHS is already on the way to building a greener service. Within the first year, setting targets, the NHS has reduced its emissions equivalent to powering 1.1 million homes annually. I think that's an amazing achievement. In October 2021, Amanda Pritchard, the NHS Chief Executive, stated that climate change is a health emergency as well as an environmental emergency. Over 1.3 million people work in the English NHS, making them the largest employer in Britain and in Europe. The NHS have acknowledged that they can play a significant role in reducing our carbon footprint, limiting our impact on the environment and making a significant difference to the public's health. In June 2022, all of the 212 English NHS trusts have completed their green plan. And the NHS website summarises this position really well. So hopefully, as long as my IT works, I should be able to share a video directly from the NHS website, which is really great at showing the work that they've done.
Climate change and air pollution poses a major threat to our health now and for future generations. But by reducing harmful carbon emissions, we can improve health and save lives. That's why the NHS is the world's first health system to commit to reaching net zero carbon. By 2040, we will reduce the emissions we control to net zero, saving lives and improving the world we live in. By 2045, we will reduce the emissions we can influence to net zero. This is emissions related to the goods and services we buy from our partners and suppliers. It's an ambitious but achievable goal. We're already making changes to reduce our carbon emissions, and these changes are also improving the quality of the care we provide now, letting us save money and reinvest in care for you. With the support of staff, partners, suppliers and patients, we have put together a practical plan to achieve this goal. We're doing this in a number of ways. Supporting travel that reduces carbon emissions and improves local air quality. Changing the ways our buildings are powered. And saving energy to support a lower carbon health service. Decreasing our waste. Reducing emissions from the medicines and gases we use. Working with suppliers to change the way they manufacture the things we use. And introducing digital innovations and lower carbon ways to care where it benefits patients. Thanks to the efforts and innovations from NHS staff, suppliers and partners up and down the country, we're already on our way to reducing emissions at the source. If we act now, we can improve health now and for future generations. Healthier planet, healthier people. Join us and act now. Search Greener NHS.
So that slide previous just talked about all the brilliant work that the NHS is doing in terms of carbon emissions. So what has the NHS specifically done? So they've created a supplier roadmap to net zero. So the detail on the screen, although it's very small, details what their plan is. So the Health and Care Act 2022 came into play from July 22, and it inserted a selection of climate change provisions into the NHS Act 2016. Building on this, the NHS has also published the Net Zero Supplier Roadmap, which requires that by the end of the decade, the NHS will no longer purchase from suppliers who do not meet or exceed its carbon zero commitments. In April 24, all suppliers need a carbon reduction plan in place. This is light touch, doesn't have to be a full reduction plan in place, but it's a commitment to reach net zero by 2050 that your suppliers will publicly state on their website. By 2040, they want to reduce emissions to net zero, and by 2045, emissions that the NHS can influence to net zero. So this includes their customers and suppliers. The overall aim is to save money, help the environment, and to reinvest in patient services. So there are some simple actions that we can make. I always think of this as not just being in the NHS or in our practice, but also at home, anywhere we are. So some simple actions we can take include turning off monitors, printers, and enabling automated sleep mode, turning off lights overnight during the daytime or when we're not in our rooms, closing doors and controlling temperatures, powering buildings in different ways, including solar, trying to reuse where we can. So this is cups, bottles, cutleries, and avoiding single-use items. Where possible, we should be trying to switch from single-use plastics to sustainable alternatives. And I know this is a particular challenge in the NHS. We need to be using the right bin, clinical waste paper or food waste, and minimising our landfill. Trying to replace a car journey. So could we walk, cycle, or use public transport? Again, another thing that's not always easy in our local area. But could we car share if that was appropriate? Trying to be more innovative. The NHS website has some brilliant examples. So using a refillable bottle for a year saves 64 kilograms of CO2 compared with single-use plastic bottles. Can we turn off equipment and lights and control temperatures? This can make a massive difference and reduce carbon significantly. Saving one car journey a week of an approximate 16.7 miles, which apparently is the average daily commute, can save the equivalent of 230 kilograms of CO2 per person over a year. Using the right bin. In 2017, the NHS sent 15% of its waste to landfill, a total of 47,000 tonnes and a weight equivalent to 650 times the Space Shuttle. With 60% of the NHS carbon footprint calculated to come from the supply chain, there's a clear opportunity for private sector operators within the supply chain to innovate and create healthcare products and devices that are more environmentally friendly. So some examples of some products. In terms of products, there are many examples through healthcare services in which continue to be used at great cost to the environment. The challenge is to eliminate these. A simple example is a metered dose asthma inhaler, the propellants in which are greenhouse gases accounting for 13% of the UK NHS carbon footprint. It's looking at industrial processes of remanufacturing, so a step beyond simply recycling. In terms of infrastructure, private sector clinics and hospital providers can demonstrate their environmental commitments through infrastructure projects, powering their premises using renewable sources and partnering with public sector providers to help them do the same. In terms of technology, digital healthcare solutions have grown exponentially during the pandemic, and it's clear will continue to do so for coming years. So dare I say I've got another video which I will try and share, but we may be giving up.
A year ago, the NHS became the first health service in the world to commit to the target of becoming net zero with its carbon emissions by 2040. This is because there's a direct link between the health of our planet and the health of our people. It will contribute to increasing extremes of weather such as heat waves and flooding, putting our health at risk and disrupting the care that we provide. Air pollution remains responsible for 1 in 20 deaths in the UK today. So by caring for the environment in which we live, we're caring for the health of every single one of us and proactively improving healthcare, not just now, but for future generations. We're already showing that progress is possible. Since 2010, the NHS has reduced its carbon footprint by 30%. Here in Newcastle, I'm proud to lead an NHS trust that has really championed sustainable healthcare from day one. Just last month, our birthing centre supported the first mum in the UK to give birth to a healthy baby using climate-friendly pain relief. But we're not alone in pioneering greener innovations. A site in Milton Keynes has installed 2,500 solar panels, generating more than 1.5 gigawatt hours of free electricity from sunshine every year. That's equivalent to 15% of their total electricity. They fully power energy-demanding CT scanners, MRI machines, and so are securing healthcare for the future. And in Bristol, anaesthetists are proving that excellent patient care is possible while being good for the environment. Their drive to use greener gases and remove the use of any unnecessary gas has seen them reduce their impact significantly. They've removed the equivalent emissions of taking 300 vehicles off our roads. But while everything I've mentioned is hugely positive news, we aren't about to stop there. If we do more together, we can reduce our emissions and thereby reduce admissions, helping to prevent cases of cancer, heart disease and asthma. With the help of over 1.3 million of us staff in the NHS, we can achieve even more. Together, those small changes to our everyday actions within your working life can add up to a huge impact. Discover how the NHS is going greener for yourself. Search Greener NHS today.
So what has Duncan Toplis done? So I just wanted to tell you a little about what I know about ESG. So as Kay said earlier, I was appointed the Sustainability Champion in early 2023, and this included being involved in calculating our own carbon emissions and engaging with the whole team to drive forward sustainable initiatives. Duncan and Toplis have launched our impact report, and it can be found on our website. It covers things like what the foundation has done, so the great work and charitable donations that we have made. It looks at the team in terms of equality, diversity, mental health awareness, menopause support and free online fitness. It talks about our clients and community impact, as well as the waste reduction policies that we've tried to put in place. These include clothing collections, blister pack and pod backs, tub to pub scheme and also solar panels. So I've told you a little about our journey, and this was really just to illustrate my understanding is real. Duncan and Toplis are committed to making a difference too. So if this is something you're interested in, there's more information on our website. I hosted 3 webinars, so 1 E for environmental, 1 on S for social and 1 on G for governance. And also the NHS website, the Greener NHS, is also a great resource. So I think back to you, Kay, and I'll take any questions that anyone has at the end. Many thanks for your time.
Super, thank you very much, Sally. What strand of ESG do you think is the most important?
I think every single strand will be different for different people. So we have clients who are really, really interested in the environmental. So the next Greta Thunberg would literally be excited about anything. We also have clients who are impacted by the impact of significant rainfall and climate change. And then social, if we don't have engaged team members or brilliant policies, then how are we going to attract the right team members? That's for us, for the NHS, for everybody. And then in terms of governance, we all need to be setting the right tone from the top. I think the NHS have done a brilliant job of doing that. And that's why I wanted to share some of their videos, not very successfully, thanks Will for helping, but just some of the statistics in there, like 1 in 20 deaths is responsible because of air pollution. And that since 2010, they've reduced their carbon footprint by 30%, I think is absolutely amazing. On the other video, I wasn't so sure there was a mother of 2 about the climate friendly pain relief during childbirth. But anyway, that's a different matter altogether. So in answer to your query, what do I think is most important? I think all of them are equally important, but we'll find that some people are motivated by others, by some more than others.
Super, thank you very much. Thank you very much, Sally and Hurn, for joining us this morning. There aren't any more questions in our Q&A chat box. If anybody does have any, then please do complete those feedback forms and add them to that. So now I have pleasure in welcoming Chris Jarvis. For anyone who wasn't with us last week and the week before, Chris is a former CQC inspector and brings a wealth of experience in healthcare regulation and quality assurance, having dedicated 11 years to the CQC as an inspector. His extensive experience as an ex-CQC inspector has equipped him with the unique insights into the intricacies of compliance, allowing him to provide valuable perspectives on how organisations can meet and exceed regulatory expectations. Chris is now dedicated to sharing his knowledge and insights with others. Whether through mock inspections, staff education or hosting webinars, he continues to contribute to the improvement of healthcare quality by empowering individuals and organisations with the information they need to navigate the ever-evolving landscape of healthcare regulation. So thank you, Chris, and I will hand over to you.
Good morning. Thank you, Kay. Thanks for that lovely introduction yet again. Morning to everybody on the call. Those who don't know me, I think Kay's told you everything you need to know about me. I just want to, before we move on to the effective key question, I just thought I would just reiterate what I've said before about what's happening in the CQC at this moment in time. So there's been a big reorganisation, the CQC, in terms of its organisation, both nationally and regionally. So the teams have been amalgamated into multidisciplinary teams. So in each of the teams there is now adult social care inspectors, primary medical service inspectors and hospitals inspectors working alongside each other. That's not to say they're working in each other's field, but they are. The idea was to give a better oversight across the patch as to what's happening across the various healthcare sectors. So the word inspection has been eradicated from the CQC dictionary. It's now they're now called assessments, and these assessments can take two forms really, or three forms. They could be off-site, so it could be looking at information that CQC hold about an individual practice, either information in public domain or information from elsewhere. It could be an on-site assessment, which means an inspector coming out to do a visit to have a look at specific things, or a combination of both, hybrid if you like. The aim of the new system is to try and get a more up-to-date and relevant assessment of services, so that these assessments were more frequent but more focused, so they should be shorter. But the downside to that, as far as practice is concerned, is that you really have to be on your game, because you could have an assessment at any time. You could have an inspector turn up on your doorstep at 8 o'clock on a morning and want to look at certain stuff. So it's important that you got your ducks in a row and you're ready for these assessments, because unlike previously, when the mantra was that CQC would, wherever possible, give at least 2 weeks notice to practices of an upcoming inspection, and preferably a bit longer. Now, whilst they will endeavour to give some notice, it's expected that it will be a lot shorter notice, if any at all. It could be totally unannounced. I'm aware of one recently, I think in Lincolnshire, where they got 1 day's notice. So all that said, some things haven't changed. The key questions, that safe, effective, responsive, caring and well led, remain the same. Those key questions haven't changed. The regulations, which underpin the regulatory work of the CQC, haven't changed. Their primary legislation has been a statutory instrument to allow the CQC to inspect across local authorities, but the primary legislation hasn't changed, and there's no plans for it to change in the forthcoming future. What will happen under new government, everybody's guess. I think Wes Streeting, the Shadow Minister for Health, has indicated that he would like to see a reform of the regulatory landscape, but who can tell? The evidence you need to gather to meet the requirements of regulations is the same. You don't need to change your practice and what you do to meet those regulations. So all you need to do is make sure you meet the requirements of regulations. How you do that is entirely a matter for you. The CQC doesn't prescribe how you should gather evidence and what format should be, but it obviously needs to be accessible and to anybody who wants to see it. So if they're asking for data about appointment availability. It needs to be in a format that makes sense. Okay. So this process at the moment, they're going through this trial process, which according to the CQC website will carry on until the end of June. At the end of June, they'll evaluate what's gone right, what hasn't gone so well under the new process, and during July, they will issue a final statement saying how the process is going to work going forward. At the moment, there's no planned inspections, no scheduled inspections, I should say. Assessments, I use the word inspections then. No scheduled assessments. The only assessments that are taking place at the moment are ones that are based on risk. So when the CQC get evidence, gives cause concern, if appropriate, they'll do an assessment based on that risk. Okay. It's really difficult to explain what's happening in real terms. I would urge you to go to the CQC website and try and decipher what it says on there. To me, the information CQC are providing is almost unintelligible. I don't know who, well, I do know who's written it, but I'm not going to say. But it's really, really difficult to follow, to make any sense of. All you need to know is that there's 5 key questions that remain the same. For each of those key questions, there are quality statements, or what would become known as the we statements. So, for example, in today's talk, we talk about the effective key question, and one of those is about assessing needs. And the we statement is that we maximise the effectiveness of people's care and treatment by assessing, reviewing healthcare, wellbeing and communication needs with them. So that's the we statement that underpins the assessing need in that effective key question. And for each of those key questions, each of those quality statements or we statements, there are a number of evidence categories that the CQC inspector or assessor will look at to gather the evidence support of that, support of your we statement. And those evidence categories, there's 6 of them actually, they change depending on what actually we statement the inspector is looking at. So, for example, the assessing needs we statement, the inspector will look at Regulation 9, which is person-centred care, 12, safe care and treatment, and actually it's missed 2 off there, but it's 11% and 17 good governance. And good governance, you'll see, comes almost in every key question we look at. So I'm just going to look at the effective key question. Is there any questions before I move on to the actual effective key question? Kay, can you say?
There aren't any questions at the minute, no.
Okay. Okay. If you got any questions, just interject and let me know, and I'll answer them as I go along. So the effective key question, this has always been, to my mind, as a former inspector, is the one that where practice could actually fall down very, very quickly, particularly in terms of business optimization. That hasn't changed really. Part of the one of the we statements relating to effective is about monitoring and improving outcomes for patients, and that covers a whole sort of thing, whole raft of thing, including unplanned admissions and readmissions in secondary care, vaccines, vaccination rates for immunisation rates for kiddies, and prescribing data. And prescribing data is always one that the CQC specialist advisors who do the clinical searches focus upon. So that's one of those, that hasn't changed. That effective key question still encompasses those areas. Having said that, what's been brought into effective, which we used to be in the responsive domain or key question, is about access to treatment. So waiting times to get treatment. So that's something they'll also be looking at. But I don't intend talking through each of these key questions. The key questions are quite clearly set out. Having said that, some of the information on the CQC website is almost unintelligible. Actually, the key questions and the quality statements are clearly set out. What you need to do, though, is try and read, by reading through it, understand which of the key questions are supported by which evidence categories. Because when the new process of assessment that's been handed down to inspectors is very specific about what they will and what they won't look at when they come to do an assessment. So, for example, in effective, we spoke about assessing people's needs. We maximise the effectiveness of people's care, etc. And they're only allowed to look at 3 evidence categories. That's people's experience, feedback from staff and leaders, and process. And the process is, having said that, processes are pretty much almost all encompassing. Once it includes all sorts of things. It includes looking at clinical records, not the inspector will look at clinical records. It would be done by a GP specialist advisor or one of our pharmacy people or one of the CQC pharmacy people. So process covers that. It covers dealing with significant and serious incidents properly. It includes handling MHRA alerts properly. So a whole raft of things that you would expect to come in this thing. So it is almost an all-encompassing evidence category. So I mean, I'm not going to harp on about this because it's too complicated to try and unravel on a call like this. But I would urge you to go onto the website and make the best of it. Find it easy to understand than I did, and I was this whole process has been in train for over 2.5 years, and whilst I was in the CQC, I was involved in it to an extent, and learned as I went along, and even I find it difficult to understand now in some respects. But please have a look, and I mean, I'm not a CQC employee, so I make no apology for it. It is what they put out, but I don't wish to be too critical of them. I've been an ex-employer, but I would say that their communication strategy and information to practice is woeful, to be honest. I'm going to leave it at that. Kay, any questions yet? I should think not.
There, just one that is just saying, well, it's asking if the we statements are already written, but it's asking if we've got a link. So I think you sent a link out the last couple of weeks, haven't you?
Yeah, I'll tell you what I'll do, Kay. I will go through the site again, and I'll make sure that the accurate links are sent, because the information was updated last week, actually, some of it, and but some of it's very old. Some of the information has been there since June 22. Before the strategy was even solidified, if you like. So how relevant it is, I really don't know. But that's CQC for you.
Super. Has anybody else got any more questions? There's only the one that's popped up in the chat at the moment. As we said earlier, if you do think of any other questions that you haven't asked that you would like to ask, then there will be feedback forms coming out. So please do add your questions to the feedback forms if you want a direct response. But Chris will liaise with Will in our marketing team, and we'll get those links sent out to everybody that's on the call.
Okay.
It's very quiet this morning.
It is.
Super. Okay, lovely. Well, thank you very much. The final webinar that we are running is next Wednesday, so that's the 13th, where we'll be welcoming Chris again, and he will be covering the well-led we statement. And we'll also be welcoming our HR Director, Heidi Thompson, who will be giving an HR update. So we look forward to seeing you all next week. Thank you very much for joining us.